Thank you for joining this webinar. We are going to start now. This is the second webinar of this series. We had the first webinar on 3rd, and our webinar was about the AI. How do we leverage on AI? And we went about what AI can do and what that will look like, so that we can be able to see how can we make application of the same. And then we got testimonials from one of our facilitators on how they are doing it at their university, which is a bit different in terms of adapting the process. Today, we are going to engage on the same, but looking at various elements, and we will be exploring more on getting the how you can use the AI in terms of research, and how the research is going to be benefiting from the AI. So, ladies and gentlemen, we're going to start our webinar now. Our presenter is Christopher Stavanowski. He's with a PhD. He completed his doctoral in health education and behavior at the University of Michigan School of Public Health. During his doctoral studies, he was Robert Wood Johnson Foundation Health Policy Research Scholar and the National Institute of Minority Health and Health Disabilities Global Alliance for Training in Health Equity Research Fellow. Christopher has also completed dual master degree in public health epidemiology and in health management and policy at the University of Michigan. He is with us this point to explore the use of AI in research areas. Thank you, Christopher. Welcome.
Thank you, Kevin. Hi, everyone. Thank you for coming. I see that there's 168 attendees. I'm sorry that I can't turn the camera on, but hopefully that'll come on soon. But thank you all for coming, and I'm excited to kind of share the knowledge with you on AI in terms of how to utilize AI in evidence synthesis. So I'm going to share my screen, and I'll give a little bit more context about me, my work. I want to touch base about what is the science of evidence synthesis. You may have heard terms, the lit reviews. How do we do these lit reviews? And then how now, given the advancements in creation of AI, how do we use AI to do the lit reviews to be more efficient and more accurate in our work? So thank you all for coming again. I'm sharing my screen, so I hope you all can see this, which I believe you should.
Yes,
please let me know if you can. Great. I'm gonna turn on, I'm gonna keep the closed captioning on for those who might need it. But as Kevin's mentioned, I'm Christopher Stoyanovsky. I'm an assistant professor in the Department of Social, Behavioral, and Population Sciences at Tulane University in the School of Public Health and Tropical Medicine. And I also serve as the research director for the Robert Wood Johnson Foundation Project, which is one of our main health foundation funders in the US, called Partners for Advancing Health Equity, where I lead a portfolio of evidence synthesis research. And here is my email. So if you all have questions after today's session, I'm happy to have conversations around what I'm talking about today. So thank you again for coming. So what is evidence synthesis? So evidence synthesis as a field, as I mentioned, you've probably heard the terms lit review, but what it really is a scientific study of bringing together information from a wide range of disciplines, from a wide range of sources, from that could be scientific articles to legal analysis But ultimately what its goal is to inform debates and decisions on specific issues. So we use this field, the field of evidence synthesis is really there to identify kind of where is the scientific field on a particular topic. Where is it going? What are the gaps? And then ultimately, how do we leverage this in policy programming and kind of service provision? So what it aims to do is identify and synthesize all of the scholarly research on a particular topic. It includes a systematic and comprehensive synthesis based on well-formulated research questions. And we must do this in an unbiased and reproducible way. And so I'm going to show you some tools that have really advanced our ability to do evidence synthesis later on in today's conversation together. Yeah, I will share the what I will do is share with Kevin's, for those who all registered today, I will share these slides with you so you can have my contact information, and I can share it again later today and after the presentation. Thank you for the chat. So, and to share, policymakers are really interested in evidence synthesis because it's done all of the work for them, which is systematically reviewed all the scientific evidence on a particular topic. So these types of research studies are really, really of particular importance for policymakers who are really looking for this type of work to help inform their decision making. So I've mentioned lit reviews. I've said that word quite a few times, but what most don't know is that while we say the word literature review, there's actually 14 different types of reviews that one can do. I'm not going to share every single one of these, but I am going to talk about a few that you've probably heard of just to ground us today. But each one of these 14 types of reviews are used for different reasons. So you've probably heard the term meta-analysis. So I'm focusing here on the fourth one down, which is a synthesis of all the scientific literature that then performs a statistical model that combines all of the results of quantitative studies to provide a precise effect of the results. It aims to do this in a more exhaustive, comprehensive method. We are using quality assessments, and then we're presenting these kind of meta-analyses in graphical or tabular kind of formats where we're really focused on the measure of effect. So what is the meta-analytic effect across every single study that studied that topic? What is it saying about the relationship between variables? So you've probably heard or read these types of studies, but these are really big in the literature. You've heard of literature review, as I mentioned before, but this is really just a generic term that's looking at published materials of the current literature. It may not be exhaustive. It may not include a quality assessment. And so really kind of is just this generic general term that we're using to describe evidence synthesis. What you've probably also heard of a scoping review, which is really a preliminary assessment of the available literature. We're typically using scoping reviews for literature where there's not a lot of information on the topic. In a scoping review, you're probably not going to have a really robust, complete literature search. It's really, really hyper-focused. You're probably not going to have a formal quality assessment. And again, it kind of just going to characterize what is out there so far. The one that I leverage the most really are rapid reviews and systematic reviews. So systematic reviews, you've probably read these studies, and these are really exhaustive, really large kind of evidence synthesis literature reviews where you want to find all of the scientific information on a particular topic. You are going to make sure that you're assessing the quality of those studies, determining, important inclusion exclusion criteria. You want to look at the rigor of how these studies were performed, and you're going to present this in a narrative format. And ultimately what comes out of these is that you are providing recommendations for research, recommendations for policy, recommendations for practice. So this is a much more larger, exhaustive, comprehensive evidence synthesis project. And so I just wanted to share this. I don't want to touch on everyone, but what I want to draw our attention to is that when we say lit review, what we're really talking about is 14 different types of review strategies. And we're doing these things because we want to assess the literature in different ways. So in a systematic review, you want to know everything about a particular topic. And I'm going to show you some examples using the AI tools of what these things kind of look like. So when we're doing evidence synthesis, there's roughly about 8 steps, starting at the first here on the left-hand side, where you're going to write a protocol, where you're developing your research question. What is the aims of your review? You're going to have inclusion and exclusion criteria. And then in the second step is when you're going to start going to all the different scientific databases. These are databases such as PubMed, Scopus, Google Scholar, right? All those kind of databases where you're now using search terms and a combination of search terms to find the literature on that particular topic. After you've searched in all these databases, you have your whole body of research, then you're going to do your title and abstract screening. After you do your title and abstract screening, which you're looking at your inclusion and exclusion criteria. Are these studies meeting those inclusion and exclusion criteria? And then you kind of weed them out. Then you're going to do the full text screening, which is you're looking at the full text of the article to, again, assess whether or not you should be included. After you've done that, then you're going to start extracting all the data for your particular research question from those studies. And then in steps 6 and 7, you're really analyzing and synthesizing all that information on that particular topic. And then ultimately, you're in the final step, you're publishing or writing a report based on what you have learned from your systematic review or rapid review or meta synthesis, whatever you might be working on. I am going to pause there really quickly just to see if there's any questions in the chat. So please, if you have any, please feel free to write those.
We will do a Q&A after your presentation, Christopher.
Okay, sounds good, Kevin. Sounds good, sounds good. So I'm going to walk through some of these steps. I'm not going to do all of them because I do want to spend some time in the tools themselves, showing you how they work and what they're doing. So, but really briefly, in step 1, this is where you're kind of starting your whole thing. And so first and foremost, you need to make sure that your review hasn't already been done. In your protocol, you're going to describe the rationale or the background for why we're doing this review. What are my inclusion criteria? What are my hypotheses? And how am I going to go through the process of conducting my review? In any systematic review, which are the much more higher quality reviews, you are going to use this thing called a Prisma diagram, which is a set of criteria that are required for any type of systematic review, that you're going to follow those steps as you write your protocol and conduct your review. And then when you're drafting your methods, you're going to think about who are the populations I want to focus on. Am I looking at particular interventions? Is there a comparison group? What are the outcomes of interest for me? And here in the slides, which we can send out to you after today, is you'll see some examples of protocols in this database called Prospero, or the journal Systematic Reviews. So everything in this presentation is hyperlinked for you all, so you can have all of this information. So as you're developing your protocol, you really want to think about your research question and start, you're going to start broad or very broad in your kind of question, but then you need to start to narrow down to specifics. So when you're thinking about your review of all the literature, you want to think about who am I including? So those are those populations. What am I studying? For example, am I looking at concepts of stigma? Am I going to be looking at mental health? When am I going to do this? So you might have a kind of time period that you're interested in. For example, pre-COVID-19 pandemic, post-COVID-19 pandemic. You might have particular geographic areas that you're interested in. And you might also think about, how have these studies been conducted? So you might only want randomized controlled trials. You might only want qualitative work. So you're really starting broad and you're narrowing down to the specifics of who, what, when, where, why, and how. And then you're going to conduct some preliminary searches of the literature in PubMed and Google Scholar. You're kind of going to just start to assess what you're seeing. And really, it's important to identify these key concepts and terms. So, for example, if we are thinking about pandemic preparedness as the topic, you're going to need to have terms for pandemic. You're going to have terms for preparedness. You're going to have terms for, if it's an infectious disease, you need to have infectious disease terms. So you really need to think about kind of what are my search terms that I should be leveraging when I search in the different databases. And a really useful tool that I use is PIO, which is, you can think about what's the population I'm interested in, what's the exposure, and what is the outcome that I am interested in. So as you're putting together your protocol, you're also going to think about your inclusion exclusion criteria, also known as your eligibility criteria. And this is things that you want to think about as you're doing your screening of the articles. You're not going to include every single study because it's not going to be relevant. So you want to think about what is it that I'm specifically looking for. So here in this example, we're doing a review in the United States on this topic of abortion. There's been a lot of rhetoric around this term called late-term abortions, which isn't really a medical truth, the term late-term. And so this is our inclusion criteria. So includes abortions that are quote unquote determined to be late term. We have to define the abortion time period. We are specifically looking at studies that explore why women are getting abortions. And we don't want studies that are review studies. And so here on the opposite side is we have exclusion criteria. We have a date range here. So any papers before 1973, we don't want. Any papers that are not in the United States, we don't want, so on and so forth. I'm just going to look at the Q&A. Is knowledge synthesis similar to evidence synthesis? Yes, it is similar, except evidence synthesis is really the methodological study of it all. So there's an actual method that you're putting behind all of this. And then, yeah, that's a really big question around systems dynamics. We can definitely touch about that later on today. I'm a system scientist myself, so thank you for that question. I'm glad to see it. So I'll make a note of that one for later. So I'm not going to do this with you all today because I know we're kind of in this panel thing, but one of the things I like to do when I first do my reviews is really start to brainstorm some research questions. So thinking about as you're working on this, really develop 1, 2, 3 research questions and start to narrow them down to more specific things where you're including the population, you're including your time period, the geography, the exposure, the outcome, and really narrowing down. So if you have a really broad research question evidence synthesis, you're going to end up with so much literature that it's almost not feasible for you to review all of it. So in step 2, this is where you are going to start doing your search terms in the different databases. In here, specifically, I really leverage the power and knowledge of librarians. They really have a lot of knowledge in this space. I'm going to show you some ways to think about this, but I myself work with librarians quite a lot. But there are some key strategies when you're doing your searching. So first and foremost, as you're putting your protocol together, you want to start thinking about these search terms. So for example, I gave you, we were talking about abortion a little bit earlier. So if we're looking at, we want to synthesize all the information on abortion in the United States that looks at why women are getting them, then we need to have terms for abortion in our search terms. We need to have terms that limit the geography to the United States. We need to have terms that explore reasons why women are getting abortions. So you might have terms such as predictors, factors that influence abortion. So you really need to start thinking about what are all these search terms together. And then you need to start narrowing down these search terms. So again, we don't want this to be so broad that you're ending up with thousands and thousands and thousands of articles, because that's not really helpful, but really starting to create these combination of search terms that really narrows down your topic. And so here are some databases that I utilize, just so you have them. I mentioned PubMed, Google Scholar. Although Google Scholar is a bit harder to develop search terms in, so it's not really recommended for reproducibility. You will have CINHL, ERIC, SocIndex. So there's a wide range of databases that one can look at. Yeah, thank you for the questions for the resource libraries in Africa. So PubMed is publicly available. Google Scholar is publicly available. So those will probably be your two big ones. And then something to think about is how can you leverage the university systems here in Africa as well, which some of them should have subscriptions to these services. Sorry, to these other databases. But the two big ones, and PubMed is really, 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 really expansive. So that would be your first and foremost one to look at when you're doing this type of research. Thanks for that question. So as you're developing your search terms, and these here that I'm showcasing are these things called Boolean loop operators. And I think I imagine some of you have heard of some of these, but let me just walk you through what they are doing. So there's three main ones, and it's and, or, and not. And so when you think about your search terms, so let's say we are looking at stigma and abortion among women in the United States. As you start to put your search terms together, so we would have abortion and women and US and stigma. So what the and term is doing is saying search in the database when all of these search terms are combined together. So you're narrowing down what the research literature you are finding. So if you put women and abortion, it's going to look for the studies that are talking about women and abortions. If you use the term or, as you can see here in the middle, now you've expanded your searching. And so if we said women or abortion, it's going to look at any study that has the term women in it or the term abortion and give you the results for all of that. And then if you use the term not, it's going to look at, so if I said women not abortion, so it's going to exclude those, make an exclusion between those two terms. So it's going to find you the one, but not the other. And so you're going to use these in combination with one another. And so let us go to PubMed, just so you can see what this kind of looks like really quickly. So, PubMed is a US government website. It's got all of our kind of scientific literature here. And if you just go to the homepage, you can start to search for papers. What I like to do is I go to this place called Advanced under the search bar. If you click on it, and now let's say we are doing a study on stigma. So I would say, okay, I need a search term on stigma, and I'm going to add it here. And now let's say we're going to do a study on stigma and drug use. So I will have a term called substances for drug use. And here I'm going to add it with an and. So as you can see, my Boolean loops are doing stigma and substances. Let's say I have a drug use instead of substances. So I'm going to add this with an or. So I want stigma and substances or drug use, because those two terms are basically the same thing, substances and or drug use. Let's say I want women only. So I'm going to add this with an and. Oops, sorry. So now I'm looking at stigma and substances or drug use and women. And as you can see, as I'm building out my search terms, what I'm doing is creating more narrow, tailored searches of the literature. Cool. So let me just click the search button. And if you see there, just these terms, if we included these terms, there was over 290,000 results. This is not something I would probably use in my literature. I would start to create more search terms and start narrowing things down even more to match a research question. But I wanted just to show you this as an example of how to start putting your search terms together. So let me go back to the presentation. And now, after you've done all this, and maybe this is where I'll stop sharing the presentation so I can show you the AI tools, you're going to start doing the screening of your articles. So let us just say we are going to stick with stigma and substances or drug use. I'm just going to show you how to save this. So if I click on save in PubMed, I want all of these results. Unfortunately, PubMed will only give us 10,000 citations at a time. So this, again, like I mentioned before, I would be narrowing down this even more. And you can save this as a PubMed file or as a PMID file. So if I just create, and then you will have a download. So let me show you that one more time. Let me just save it as a CSV. That might just be easier. And then it's going to take some time. It might take a little bit of time because there's a lot of literature in here, but let us not spend time doing that. Here we go. So I'm just going to open it up just so you see what it looks like. So here now it's got the PMID, which is the ID number in PubMed for that paper. It's got the title, it's got the authors, it's got the citation, the publication date, so on and so forth, and the DOI. So now you have the spreadsheet. And then there's this tool called Covidence, which is what I use in all of my work. And so what Covidence has done is it's really systematized the systematic review process. So if you see here, this is a study that me and my team are working on, which is looking at persons who inject drugs and their harm reduction needs. And we wanted to look at the literature and see kind of what is it telling us about harm reduction and the needs of people who inject drugs. So what we did is I went to PubMed, we did all these searches across these databases, we downloaded that CSV file, and then we uploaded it here.
You might need to move to the tools faster. We have about 15 minutes.
Sounds good. And so then what you do is you upload it into Covidence, so you can import here. And then the lovely thing that happens is you do all your title and abstract screening in here. So let me just show you an example. So here we're in the full text review stage of this review. And if you look, you can click, you have the title of the paper, you have the DOI, and then for this one, there's already the full text of the paper in here. So I will just click on it. It pulls up the full text of the article, and then I can read this article to ensure it meets my inclusion criteria. If it does meet my inclusion criteria, then you're going to hit the include button, and it'll push it to the next stage, which is data extraction. So this tool, Covidence, really allows us to do all of our review process doing the title and abstract screening I mentioned, doing the full text review, doing the data extraction, all in Covidence. So everything is managed through this system rather than you having to do things by hand in Excel. And then the lovely thing that it also does is it gives you this, it's up here, which is called Prisma. It gives you that Prisma flow diagram. So if you've ever read systematic reviews papers, the journals are always asking you, I want to know how many studies you started with, how many studies did you screen at the title and abstract stage, how many did you screen at the full text stage, so on and so forth. And this tool, Covidence, tracks all of this for you. And then you basically can just download this into a Word document and you upload it when you submit your paper to the journal. It's a really lovely tool. They give you free access to it. You can do up to 3 reviews in Covidence for free. They do have a subscription service, but if you are coming from low and middle income countries, they have very reduced rates on all of this. So I would definitely reach out to them for those reduced rates, but it is free up to the first 3 reviews. So what I've done before I had a subscription is I would finish a review and then I would like archive it or delete it, and then I would have a new free review. But good question there. So that is one tool that I just showcased you. And now, and what happens here in Covidence is as you are going through this process, so let me just click here again on full text. So as you are making your voting, so let's say I said include here, and as I'm reading through these articles, what ends up happening, and hi everyone, I can see you now, or you can see me now, is as you are doing your voting in Covidence, there's an AI algorithm behind the scenes that's looking at how you're voting. So as you are voting, the articles that it's going to give you next when you're doing your voting are more likely to be articles that you will say yes to, because it's learning from how you are voting in the system and it's tracking how you're doing that. And so it's looking for all those keywords that then it thinks is why you're then telling it, yes, I want to include this article. And then there's this other tool that I have started to use. Mind you, all of these, except for Covidence, this AI tool here is growing, like they're advancing every single day. But this tool is called Elicit. So you can go to their website. This one, again, is also free, but you have to be a little bit more mindful of how you use it because it only is free up to a certain amount. If you want to access the free software for Covidence, you just go to the Covidence website. So I can just show you where that is, which is covidence.org. So if you just go to covidence.org, here's their website. You can create your free trial, but I would also reach out to them because there's a lot of universities, hospitals, and institutions that have subscriptions. And so you can click here and it'll show you the list of organizations that have institutional licenses to Covidence. So some of your organizations might already have this. And again, if they don't, I would, have a conversation with your organization because they give much more reduced rates to Covidence for low and middle income countries. So this is another tool which is called Elicit. So let me just go to Elicit's website just so you can see it. Elicit.com, and it's called your AI research assistant tool. Again, they have different pricing for low and middle income countries. It's much more reduced rate. It is, again, also free to a certain extent. I have a paid subscription. I believe it's like, I believe my subscription is like $10 a month. So it's $120 for the year. And this one is much more of these AI type of tools where you have to ask questions. So one of the hard parts about AI is it's still artificial. It will not do the thinking for you. However, if you know how to prompt the system, it will return some pretty good results for you. So for example, let's say we wanted to look at the same project where it's the needs of persons who inject drugs. What are their harm reduction needs? We have to ask this in a research kind of question. You can't just type in the search terms. So here, let's think about what it might look like, which is, what are the needs of persons? Let me say, what are the harm reduction needs of persons who inject drugs? So this, I'm going to ask the AI. This is what I think my research question is, and I'm going to click on I'm going to submit it, and then I'll tell you what's happening here. So it's thinking, the system is thinking, and what AI is doing is it's a bunch of computational modeling behind the scenes. And so what AI at the most basic level, what AI is doing is saying, okay, I saw your question. What are the harm reduction needs of persons who inject drugs? So what it's going to do then is it's going to predict the next word in the sentence. And it says, okay, if I see this harm reduction needs, I think it's going to start with harm reduction strategies for people who inject drugs are, and what it's doing is just making a mathematical model of the probability that the next word is what the next word is. And then, so when it says harm reduction, it'll put the words harm reduction back into the model, and it says, okay, I think the probability that the next word would be strategies is this. So it's going to give you the word strategies, and then it feeds that into the system, and it just keeps going and going and going. But here, as you can see, this is a summary of the top 8 papers that Elicit found, or Elicit has access to. And it says harm reduction strategies for people who inject drugs are crucial for addressing health risks associated with injection drug use. So here's what it's saying. Key interventions include needle and syringe exchange programs, opioid substitution therapy, and HIV testing and counseling. Persons who inject drugs often employ personal harm reduction practices beyond conventional health-focused approaches, emphasizing agency and community building. Peer involvement in harm reduction initiatives is valuable. And however, harm reduction coverage remains suboptimal globally, particularly in low and middle income countries due to underfunding and legal barriers. So what this is done by me putting this question to the AI, it has now summarized all of this literature, and it's come to this summary of the top 8 papers. The challenge with there's some ethical and some just like methodological concerns with AI. So for example, let's say we just look at this first paper, and I'm going to click on it. It's going to open up this paper. It's going to allow you to find this paper in online. And as you can see, this is a white paper, The Need for Harm Reduction Programs in West Virginia, which is a very specific place in the United States, right? So how it comes to this as one of the top 8 papers, I don't really know. And so we have to be a little bit leery of AI because, again, it is still artificial. So however, if you look at the second one, it has 58 citations. It comes from the Harm Reduction Journal, which is a pretty reputable journal. And if we click on it, you can get access to the paper. The other neat thing about this tool is if I click on, let's say these are the 8 papers I want, I can then over here, you can start to probe the papers more explicitly. So let's say these are the 8 papers I picked and I want to look at their methods. So I'm going to click on the methodology, and it's going to then go to that specific study and tell you what are the methods it used. So for that second paper that was in the Harm Reduction Journal, it used community-based participatory research, conducted in Canada in an urban center. There was peer-based recruitment, so on and so forth. If you want to know the main findings of the paper, we'll click on that, and it's going to show you the main findings. So it found that the study expanded conceptualization of harm reduction from perspectives of people who inject drugs, including motivations and practices, beyond just health-focused concerns. So Elicit is this really cool tool that kind of rapidly summarizes literature for you. It's not going to be an exhaustive search of the literature like a systematic review will be, but it is a good starting place to help you kind of start to formulate research questions, to help you find some basic literature on a topic. But again, it is still very new. It is still learning based on everything that we're all doing as humans, because that's how it learns what it's doing. And so you can only trust artificial intelligence so much because it's artificial. And I also just want to, I'll stop sharing my screen here, but there's also some major kind of like ethical concerns around AI. So for example, I mentioned that these are all these computational models. And so what's happening, for example, is because it's running all these computational models, it's using up a whole lot of electricity and energy. And so there's now become a major concern with the use of AI in these ways that in some contexts, it's the data centers for AI are using more electricity than small nations are. And so these huge ethical considerations around the use of AI, because most of our electric grids are still based on fossil fuels. So climate change issues, and so there's certainly lots of things to think about when we're using AI and probing it, and this includes ChatGPT and all of these other things. So thanks for these questions. Elicit is used for data extraction.
Christopher, let's handle the questions. Sorry, let's handle the questions at the Q&A section. So allow me to to have you to conclude, then I'll allow the next responder, then we move on.
Sounds great. So just to conclude, and the way I'm using these tools, and let me just share you some kind of specifics. So there's a few different strategies that I'm using when I'm using these AI tools. And so the first, for any systematic review that I do, I am using Covidence to do my systematic reviews. It is tracking all of the information for me. It's giving me that nice Prisma diagram. And then what I'm doing is I'm taking my final data set of papers in Covidence, and then I'm using AI tools to do data extraction. So Covidence itself has data extraction tools that you can use, and then as does Elicit. So, in Elicit, I showed you how to ask questions to Elicit, but you can also go into Elicit, and let me share my screen really quickly. If you go here, you can extract data from PDFs. So you can upload the papers from Covidence that made it to your final criteria. You can upload them into here, up to 500 files at a time. And then you can do the data extraction in Elicit for those papers that you have from your systematic review. So I'm using this in kind of those two different ways. But as I mentioned, Covidence also has some data extraction tools itself that I can show you just really, really quickly before we go on to our responder and our discussion for today. So if you go here is another project that we're working on. So we're in the data extraction phase here. So here you can also do your data extraction kind of processes. So you assign your first reviewer, or it'll tell you who did the first extraction, who did the second extraction, what was the consensus. So if I just start my extraction process in Covidence, here it'll bring up the paper for you on the left-hand side. It's loading right now. So here's the full text article. And then what you will do is you can start to extract the information that you need from your specific project. And so you just start to pull these things in here. What I've encountered is the data extraction templates and tools in Covidence are less AI, a little bit more manual, versus the data extraction over here in the Elicit tool, which is definitely much more AI generated. So you still need to do your double checks. You still need to confirm that what is extracting is correct, because as I'll say it again, it is still artificial intelligence and it is still learning.
It is artificial intelligence, and it is learning. Thank you so much, Christopher,
Yes.
for that. And allow me to bring in the responder, and after that, I will also bring in Wandera, who has joined us, had some issues, so that he can be able to run the Q&A session very fast. Sianda is currently pursuing his MSc in epidemiology with a specialization in epidemiology and biostatistics at the Wits School of Public Health. He is actively involved in teaching at the university and is keen on the interest in mental health and obesity and the neurological robustness of data, and has used AI in a number of ways. So I'll give him that minute to make a responding comment, and then we move on to the Q&A, which Wandera is going to host. Thank you very much.
Something will just respond without sharing.
I'm not sure why you are quite low on your volumes.
Oh, my volume is low. Okay, let me just try and increase it. Can you hear me now?
Yes, we can hear you very well. Thank you.
Can I share my screen? Okay. All right. So basically what we did is that we, I wanted to share something because I prepared something very short. Just to share my screen in terms of what we did with the class. But basically what we were involved in is that we were trying to use AI in qualitative data analysis, in content analysis. So this was a group of honor students that we had. So what we did is that we did AI, and we showed the students what AI is, particularly generative AI, in that you can deal with issues such as content generation, translations, and text summarizations. And so in a very short way, qualitative data analysis really involves if you're looking at statistics, maybe for instance, if you're looking at means, that's like a summary statistic. And here you're building from the data as you have it in its transcription, and you're trying to find abstracted meanings in qualitative data analysis. So that's what basically it is. And so our task was not really to replace human intelligence, really, but it was to augment or enhance human intelligence, because there are some of the things that we might miss, particularly when we're dealing with data that are big. And so we used this journal article by Kristen and Petra, and really they showed us here, they give us the excerpt, where we have the excerpt, where we have, and actually it's an excerpt of, let me just hide this floating thingy. It's an excerpt of an interview on patient who experienced, who were experiencing the emergency center after an accident. And these are the themes that the author kind of like extracted from the data. There's theme number 1, there's theme number 2, theme number 3. But what we were really doing is that we were comparing what the author did. For instance, here, they speak about reliving her pre-hospital experience based on that excerpt. And the second thing that they have is that they didn't feel like a person, but they were just a body in the ER. And obviously the third one here is in blue. It says that they felt like they were invisible, alone, and in pain and broken. And of course, you have those codes that are associated with the particular themes and categories. And what we did is that we took this from the article, and as we were teaching the class, it's a research course that we have. We took this and then we said that, you know what, maybe perhaps we can use ChatGPT and perhaps try and compare these things. It was our inaugural trying out this thing. And of course, we used ChatGPT. And as you can see here, of course, that there are loads of parallels between the themes and the codes, the categories that the authors initially did, and compared to these ones that we just prompted ChatGPT. And this is what ChatGPT gave us. And in comparing these things, of course, we know that you can see my highlighting over here. I'm going to mention this later as I'm drawing towards a close. You know, it mentions something about face marks and so forth. But as Christopher was even speaking about it, is that it uses probability, and unfortunately, sometimes the output that we get from these generative artificial intelligence applications are not based on really on facts, but they are based on probability. You know, these are some of the limitations, of course. And this is the first one that I've mentioned. The second one is fairness and bias. The third one is copyright. And I think Stefan also, Christoph, also mentions things of concerns of environmental concerns and then the running of these AI platforms. And some observations that we have, you know, there are similarities, of course, and there are differences in terms of the latency, because the human intelligence is able to abstract the reality of the responder much more, and compared to the AI. But there are differences, but at the same time, there are loads of similarities. But the main point is that students should not rely on AI, but they can use AI to augment or to enhance human intelligence. I think that's the point that we're trying to make. We are trying to see this new tool that is out there, and we're trying to see that, you know what, let us not be reactive, but let us actually trailblaze and see how we can be able to improve research using these AI things. And of course, Dr. Sarah Niveau, it was also some observations that she had also, and I included them in this slide here. It says that it can become this additional tool in our teaching and learning arsenal, you know, and in education, we must consider the underrepresented students, communities with tools and skills to understand the assignment. And of course, she goes on to say that, you know, this thing is a joint venture between teachers and students on how we can trailblaze and see new opportunities. And of course, this line over here, you know, it's very important. Always verify with scholarly articles. And in our case, we are saying that we are verifying with human intelligence, because we don't rely on the AI, but what we do is that we use it to kind of like enhance our own experience in research. And we think that if we can do that, then I'm thinking there's going to be much more support in doing our research. And of course, George Box always said, all models are wrong, but some are more useful than others. Thank you, sir.
Thank you so much, Yanda, for that quick rejoinder of what Christopher did. And allow me to, as we enter into the sections of Q&A now, we'll bring in Dr. Stephen Jembo Wadera, who is a demographer, population scientist, and a senior lecturer at the Department of Population Studies at Makerere University. He is also a Carter Fellow, and we are proud of some of the things they are doing. He has been able to do above 2 postdoctoral fellowships and all that, and he's going to moderate the next section of the Q&A. We will concentrate on the questions that you have put on the Q&A section, and then we're going to be able to answer that. Welcome, Wandera. Thank you.
Thank you so much, Cavens, for the introduction, and thank you, Christopher, for the very wonderful presentation. I came in like maybe quarter way, you maybe covered quarter way, but it was very nice and very good. And also, Sianda, thank you for that very nice, challenging presentation. So I would like to invite all the participants on the call. Thank you for joining us. So quite a good number. We have some open questions. There's some of these that Christopher has already answered. So we have some open questions in the chat. One of them is maybe, Christopher, if you want to take this on. What are the data privacy concerns of AI in research? Maybe you could say a little bit more on this. And then maybe somebody asked, Paris asked the question, which AI models have security of personal data? So maybe you can combine this and then we can get more. So I would encourage all the participants, if you have a question and answer a question, please I'll put it in the chat so that we can see it quickly. There's a part for Q&A. Thank you. Over, Christopher.
Thank you. Thank you. Yeah, you know, these privacy questions are very, very massive issues with AI. Well, I will say, let me start with, I don't know that I trust any of these AIs to secure anyone's personal data. In fact, we're seeing our major lawsuits against these AI companies for stealing copyright property, for example. So in ChatGPT, the AI that feeds or that's behind ChatGPT, the first data set that the AI behind GPT learned from was just a big copy of the internet. So all the information on the internet was fed into the AI system so that the AI system can learn from all of the internet. The second piece of information that ChatGPT then learned off of was of all the patents in the United States was fed into the AI system. So it now has all the information on all the patents, who patented what, how it was patented, everything like that. And then the next biggest piece, and this is where the lawsuit came in, was for ChatGPT. They then took all of the New York Times, which is a major news outlet in the United States. It took all of the New York Times articles and fed it into the AI system to learn off of. And so New York Times now sued ChatGPT and was like, well, actually, that's our copyrighted papers. Those are our work. That is ours. You can't just take it, learn from it, and then spit out information based on all the work that we did. And so there's huge privacy ethical considerations around AI. And for AI to work, the way AI functions is it learns off of all the information that's fed into it. So it's just like a big information monster. It wants to eat all the information out in the world, because the more information you feed it, the more it learns from it. And so I really don't know what privacy looks like in the world of AI. I really don't. Even these transcripts, so I do some qualitative work with AI where I feed my qualitative transcripts into it. That information is going to be in that AI system forever. It's never going to leave. It's done. And so we have to be super mindful of how we use these tools. I am using AI mostly in this work of evidence synthesis, which itself has its own implications, right? Like it's learning off of all these journal articles.